Anthrax is just one of the many deadly diseases that modern medicine has, over the years, managed to treat and control. The disease is spread through a bacteria called Bacillus anthracis, and while it mostly affects livestock, it can be transmitted to human beings that come in direct or indirect contact with infected animals. Over the past decades, Tigray's animal health system, through wide-scale vaccination programs, has been able to curb the spread of the virus. But following the start of the conflict, that has exhausted health facilities and blocked the entry of important medical equipment, the head for the Bureau of Agriculture and Rural Development has announced that diseases such as anthrax and rabies are on the rise, with at least 4 people and more than 200 animals dead. This is Yechila Primary Hospital in the district of Abergele, and we met Gabriel Libanos and his son. His son was infected with the bacteria on the skin near his eye and is at risk of losing his eyesight. He tells us that his son became ill after he consumed beef of an animal that had passed away suddenly.
We had eaten a dead cow. It was after then that he got sick. The cow was sick for a day and then died, and we didn't know what its illness was about. Everyone in our family consumed the meat. We went to a health facility in our vicinity, but they couldn't help him there, and so they sent us here.
Chief Executive Officer of the primary hospital, Erde Asafa, says that 4 people among the 99 people that had visited the hospital to receive treatment for the infection have lost their lives. But Erde says he fears many more cases may be out there.
This year we have recorded more than 99 cases of anthrax in this hospital. We know there are more cases out there that are just the cases recorded in this hospital. We lost 4 patients. There are probably many more than have died in their homes. We lost 4 patients. There are probably many more that have died in their homes trying to treat their illness with traditional medication.
The Chief Executive Officer also emphasizes that, due to the blockade, the level of care that can be given to patients is quite limited.
We are unable to provide prophylaxis even to the risk group due to shortage of medical supplies.
Atinkut Mazgabo, head for the Bureau of Agriculture and Rural Development, says that more than 22 million doses of vaccines were given out each year to prevent the spread of the bacteria in Tigrai, but says that this number has come down to a drastic decline due to the siege and attack on Tigray's health system, with just under 4 million doses being given out this year.
The past 5 years in Tigray, we used to give about 22 million doses of anthrax vaccinations each year. But this year, we were only able to do about 3.7 million. There are over 2,500 animal cases of anthrax in Tigray at the moment, and 215 have already died.
Almost 4 months into the humanitarian truce declared by the Ethiopian government, Tigrayans have continued to die of easily curable diseases that cannot be denied to innocent civilians.